we are going to study about one of the most important extraoral radiographic technique for TMJ or for condyle. That is nothing but transferential projection. Based upon the direction of central ray or X-ray beam, McCune-Dell's transferential projection is also known as lateral infracranial or suprasigmoid notch projection. This projection is exclusively for mandibular condyle. With the help of this projection, we can have visualization of superior or articular surface, medial pole, head as well as neck of the mandibular condyle. We can also investigate the presence of degenerative joint diseases affecting the temporomandibular joint like rheumatoid arthritis and osteoarthritis. This view is also useful in investigating the presence of pathological conditions affecting the condylar head like cysts and tumors. This is also useful in studying fractures of head and neck of the mandibular condyle. So all these are indications for transpharyngeal view. Now let's learn about the procedure. This projection can be taken with an intraoral X-ray machine and it can also be taken with an extraoral X-ray machine. Usually this projection is taken with maximal mouth opening position. The need for maximal mouth opening position is to move the condyle away from the base of the skull so that the condyle or temporomandibular joint of the interest is projected into the shadow of air containing spaces of nasopharynx, which helps to increase the contrast of various parts of the temporomandibular joint, and there won't be any superimposition of bony structures. That's why we are asking the patient to open the mouth while taking this projection. The film is placed in a cassette holder which may be held by the patient. The head of the condyle to be radiographed is centered on the cassette holder. Mid-sagittal plane of the patient should be parallel to the cassette. The X-ray tube head is positioned 25 mm below the zygomatic arch and about 20 mm in front of the tragus of the opposite side, and the angulation is -5 to -10 degree. The central ray is directed across the pharynx. That's why it is known as transpharyngeal projection. Trans means across or beyond or to the other side. The central ray is directed across the pharynx just above the sigmoid notch. That's why it is known as suprasigmoid notch projection. Central ray is directed across the pharynx just above the sigmoid notch through the window which is formed by zygomatic arch, condyle and coronoid. So we are directing the central ray laterally just below the cranium. That's why it is known as lateral infracranial projection. Infra means below. The patient is instructed to slowly inhale through the nose during exposure. This is to ensure filling of the nasopharynx with air. Modification of transpharyngeal projection is known as Palmer's contact technique. So in this technique, we are removing the lead-lined open-ended cone of the tube head and we are bringing the tube head closer to the skin surface of the patient. This is to produce magnification of the tube side structures and also to reduce superimposition. Because of the higher radiation dose, this technique is not nowadays used. And these are all the exposure parameters for a standard transpharyngeal projection. While using intraoral X-ray machine, following these parameters are used. Kilovoltage peak is 65 to 70, milliampere is 7 to 10, and exposure time is 0.8 seconds. While using extraoral machine, kilovoltage peak is 40, milliampere is 40 and the exposure time is 1 second. In order to obtain clear view of styloid process, we can reduce the exposure time. So this is all about transpharyngeal view.